Well, for years, the only measures that we had of the way the body was responding during this strong state of craving and arousal were really peripheral arousal measures with the polygraph, looking at the pity-pat of someone's heart, the heart going up, their fingertips getting cool, the fact that skin resistance would fall across 2 points on the skin. And those did give us an index of arousal, but they're imperfect because actually when you're running from a bear or running to your cocaine or your lover or your chocolate, you would get aroused, but you wouldn't really know how specific this state was to craving or wanting. When you're running from a bear, it's not certainly because you're craving the bear. So one of the things that, of course, we would have wanted to know for many years, but only recently have had the ability to ask it, is what is the unique brain signature of this state? What goes on in the brain during this time? It's a critical question, not just out of curiosity, because if you're going to try to develop an anti-craving medication, you really need to know what's going on in the brain.
0.
Cocaine withdrawal-like feelings, same scale, 0 to 9.
0.
We had the opportunity to use PET scanning, which monitors, in this case, brain blood flow, to look at the regions of the brain that are active when people are in this state as compared to other non-drug states, neutral states. So our patients are in the PET scanner and are watching either neutral videotapes, not at all drug-related, often animals from public television, and cocaine-related tapes. And so what we see here are some images that are taken from those periods of time. For example, this is a slice through the brain, like a hat band slice at the level of the temporal lobes of the brain. And the structures, two of the structures that we're interested in, the first is the amygdala. These are little almond-shaped structures that are nested in the temporal lobes that we know very important for learning about pleasure and reward, for linking stimuli or cues in the environment with those biologically important events. And so we expected that when people saw cocaine videos that these might be more active. And in fact, here we have a scan where our demonstration patient is watching a nature video, and you can see that on this particular scan there's not much going on what's called the right amygdala here. This is actually the left amygdala. But when patients are watching a cocaine video, you can see that this area becomes much, much, much more activated. It's now sort of white hot on the color scale. The other region that we were monitoring was the anterior cingulate, a region that is in the forebrain, above the eyebrows, in the cortex, in the frontal lobes of the brain, and it is involved in selective focused attention. And one of the things that you heard Greg describe earlier is that when people are in a state of craving for cocaine, all of your thoughts, all of your attention is focused on the drug and not very much on anything else, up to and including even consequences of using the drug that are negative. It's just on this immediate cocaine-related event. We thought that when people were watching the cocaine video that their attention would be increased and that this area, which is also known for a role in emotional reactivity, would be activated. So during the nature video, you can see that there's one level of activity, but when the video shifts to cocaine, this area becomes intensely activated. So the activations in both the amygdala and the anterior cingulate are highly reliable. These are significant findings, and that's true for the group as a whole. In this particular patient, the activation is much more prominent in the left amygdala, but it actually occurs on both sides of the brain. We've been able to show that in the group as a whole. We also looked at other brain structures to see if this effect did not occur, because you're really looking for specificity here to see if, in fact, activation occurs in the limbic system, but is not just in other places like motor regions. When we looked in motor regions, the basal ganglia actually showed a decrease in blood flow. So it shows this is not some non-specific effect all over the brain. And the effect was very specific to these emotional memory regions. To our tape, we don't show activations, for example, in working memory regions in the brain, dorsolateral prefrontal cortex, or even in the hippocampus, which is really more important for factual memory or explicit recall than for the recreation and reliving of an emotional state.
0 to 9. To what degree, if all right now you're feeling any cocaine-like high feelings?
We're at the stage now where we're beginning to sort of form a map of where the action is in the brain, what structures are reliably activated during these craving states, and we want to be able to try to distinguish the craving for cocaine from the state of fear for running from a bear. So we need to develop some fairly fine-grained pictures of the brain signature for these different sorts of arousal states. We can also, with PET technology in the future, begin to ask the question of what neurochemistry is involved, and then we're really getting down to the nuts and bolts of this state. We can actually have transmitter ligands. We can have ligands that sit on receptors for dopamine or for other chemical messengers and see if those are displaced or washed away when we are activating patients with our videotapes. If they are more readily washed away or evacuated more quickly when patients are in a state of craving, then we can infer from that that the given chemical messenger is important. So one of the things that we want to do after developing the anatomical map of where craving is in the brain is to develop the neurochemical one, because that's the thing that's going to really help us in terms of developing medications. So I think where we're going to be able to be in the future, hopefully, is having a neurochemical signature of this state, a neuroanatomical one, and be able to develop medications that have very specific effects. Anti-craving medications pose an interesting question. We would like to be able to reduce the craving for cocaine without necessarily reducing the desires for other good things in life. And since the reward circuitry for cocaine is shared by the rewards for normal pleasures like food, sexual behavior, it's going to be a challenge to have a medication that is either specific enough in terms of the families of receptors that it activates, or in terms of its range of reducing activity that leaves desires for the good things in life intact, so that it's still worth getting up in the morning, going to work, buying chocolate, doing the things that you normally enjoy, but that your cravings for cocaine are within a manageable window. The thing that we ought to be able to do then, once we get a medication, is combine it for the best, hopefully synergistic action with our behavioral therapies. It's always true that for medications you need to give them in the context of a good set of behavioral supports. You can't just spray medications from planes and hope for them to be effective. So all the good work that we've done up to this point in learning the most optimal behavioral strategies should be able to be combined with our biologic strategies for what we hope will be a major impact on this really tough disorder.